We have been brainwashed in the field of dentistry that anytime a patient's asking for pain medication, and that's unfortunate because a lot of the profession of dentistry, we basically made that issue. Yo, what up? It's a tip of the week, and today we're going to discuss part 2, indications for TORI removal. But we're not going to talk about the indications per se. What we're going to do is we're going to talk about the consequences of TORI removal. So I was minding my own business and I see this comment from DS, and he was saying that pain wasn't on the list. Well, DS, I'm so glad that you clicked on this link. Guys, I'm Dr. Jared Williams. I'm a concierge dental surgeon, and all I do is do implants, third molars, IV sedation, and coaching. And so the reason why I created this channel is because I got to the point, I saw so many challenges within dentistry. I was just like, I don't want to complain about the issue. I want to solve the issue. And so I created this course for dentists all around the globe for you guys to smile after surgery. So if you're new to this channel, welcome. Go ahead and smash the like button, share, and subscribe so that you can get all the content every time we make videos. Now, this one in particular is specifically for all you patients out there that are potentially going to have this surgery or are healing from the surgery or recovering, all right? So sit back, relax, and let's get forward. So one thing I want to talk about first is the reason why I haven't posted a video in a little while is this. I've had this freaking sty on my eyes and they've been going crazy, and I've kind of been a little camera shy. So I've just been like, you know what, let me just hold off. Let me have like a sabbatical. But for whatever reason, the drive inside of me is so strong that I'm willing to show y'all this monster that's on my eyes, and I'll probably give you some updates as the weeks go by. But anyway, I wanted to go ahead and create this video because, like I said, there's a patient out here that stated that, hey, and I'll read it for you. DS says, pain wasn't on the list. I've had this surgery for twice in the last few years. On the left, then recently on the right. The left side was so bad my gums were thinning and the bone growth was so excessive it grew through the tissue. Before that was very painful, ulcerated, and would not heal. I think it's important to listen to patients when pain is a complaint, and that should be at the top of the list. Well, DS, I'm so glad that you gave me that comment, because the reason why I created this channel is so that doctors around the globe will be aware of comments like these. Now, when I have a patient that has comments like these, I don't disregard them. I will definitely do everything in my power to make sure that we address those concerns. And if I forget, because I'm human, I have a team in place that will contact my patients, and should there be an issue, they'll pass it on to me. And since I'm a concierge dental surgeon going to multiple offices around the city, what I'll do is I'll have the doctor of the practice follow up with that patient as well in about 7 days from the procedure, so 1 week, so that nobody falls through. So that's 3 layers of defense, so that if something happens, we got it covered. So since you're a dentist or you're a patient right there, just keep that in mind, because sometimes we as doctors get so laden with so much work and so many different responsibilities, it's easy for us to forget. And so I don't want you to charge it to our heart, charge it to our head. So really want to take that in consideration. So I'm giving you this information to not just dentists, but also you patients that are here that are wanting to find a dentist that's going to be competent and capable and allow you to smile after surgery. So let's just jump back into this comment. So yeah, pain wasn't on the list, DS, because I was really talking to the doctors, but I'm going to address this specifically. Unfortunately, I did not address it, but now I'm going to. So pain is going to be a bear. I always let my patients know, if you're going to get TORI surgery, it's going to hurt like the dickens, because in the mouth, on the lingual side, which we call as dentists, by the tongue, the tissue is very, very, very thin, very thin. And we call that movable tissue or non-keratinized tissue. That non-keratinized tissue is so thin that if you have a little bit of bone spicule or little splinter, I would say, like for bone, it could literally pierce through those gums and really cause havoc on you. And so one thing that I teach doctors when they're doing these procedures is, when you remove the bone, don't just feel the bone on bone, your finger to the bone. lay the tissue back over the bone, and then rub to see if there's any bony spicules. And that's probably what happened that was causing you so much pain. But I also want to let you know from the patient perspective that, hey, these procedures are a bear. So I talked about the non-keratinized gingiva. Well, I want to talk to you about keratinized gingiva. So if you put your tongue at the top roof of your mouth, that's going to show you the difference between the keratinized gingiva and the non-keratinized. And you should already see the difference. The gingiva by your tongue is so smooth and it's movable. The tissue on the top of your palate is hard, firm, and thick. It's kind of like an alligator's back in a sense. And so you want to keep that in mind. So the procedures that we do, especially with the tori, if it's on the bottom, it's going to be very, very, very tender and sore. And then you have this most powerful muscles in this world, and that's your tongue, because life and death lies in that thing. And then it moves and sometimes can have a mind of its own. So you got to take that in consideration. So tori removal, especially on the lower, could be a bear. So I'm sorry that this happened, but let's continue addressing these concerns. Personally, I don't know. Now you talked about, having the surgery twice. Sometimes we as dentists will do that just depending on the size of it. But typically I tell patients, hey, you're better off getting everything done at the same time so you heal once. But it doesn't take away from the fact that when you have this procedure, that you're done. Sometimes tori in the literature states that these tori could grow back. Now, I've been practicing for 10 years. I haven't seen any of the cases that I've done grow back, but it doesn't take away from the fact that they won't grow back. And so sometimes you just are in the luck of the draw of having these challenges to where, one, you got to split the procedure in half. So what happens is you do the procedure, you're bracing for the worst case scenario, and then you heal, and then you got to do it all over again. Brace yourself, heal, and it's just like, it could be a disaster, nightmare. And that's why I like to offer IV sedation, oral sedation, nitrous. It's just something to knock the anxiety off of you so that you can literally smile after surgery. And then one thing that we also have to take in consideration is going to be ulcerations. Now, I remember I was doing a procedure, and this is probably the largest one that I ever did. This guy was about 48 years old, and his tori were like the size of my fingers, like these two fingers, and they're in his mouth, and it was so massive, like it was crazy. I think I have a picture, so hopefully I could throw it up there, but it was crazy. And when I did the procedure, I knew that I was going to have to do a revision surgery because, one, the procedure took forever, and two, his tori were just so massive. In situations like those, I always let the patient know, and just be aware that, once again, doctors are not perfect. Doctors are not gods. Doctors do not walk on water. We are regular, everyday people just like you. And if you're a dentist, listen to this, remind yourself, you're just a public servant. You just went to school a little bit longer than some of the other recognized public servants. So with that being stated, I told him, I was like, hey man, these tori are going to be massive and the surgery is going to be long, and we're going to have to do a revision surgery. By planting that seed, it allows the doctor to be at peace. It allows the patient to acknowledge the fact that, hey, we may have to come back in here. And then it continues that rapport. When rapport is not broken, then patients and doctor relationships can move in the direction for growth. And sometimes growth goes down to go up, but you don't want to just have it going down and just getting worse, because that's when you have a significant amount of challenges. So another thing to also take in consideration. So I let the patient know. He came back in for the revision surgery. His gums were ulcerated to the core. When I'm giving anesthetic, I sometimes cringe when I'm working on a patient that's so close together in terms of time frame. So I want to say he came back within about a month later, because he was just so sore and all his tissues were still inflamed. And unfortunately, there's other medicaments that could happen, but sometimes, guys, I prefer to just let the body take its course, because we're fearfully and wonderfully made, and the last thing you want to do is start adding medicaments that could just soothe for the moment but just delay the healing moving forward. And I kind of look at it like, when I was a little kid, I would run around and I would I'd fall and I'd scratch up my knee. What would happen was, typically, if my mom would go ahead and pour the peroxide out and burn a little bit and have little bubbles, and then she'd dab it, and I'd be and then every kid loves Band-Aids. You want to slap a Band-Aid on there. But we all know that when you cover up that sore wound, what happens is sunlight can't get to it, air can't get to it, and what ends up happening is it keeps that area moist. And we know that clots are harder to find if they don't have sun, harder to make if they don't have sun, and just the air to make that crusty surface to form a scab over it. So sometimes it's best to just let the patient heal, give them some pain medication, give them some rinsing protocols, some soothing protocols so that they could get better over time, but just don't rush it. All right. And we're about to wrap this up. And it says, the last but not least, patient complaint. I think I touched on this already, but it's so important. DS, I'm glad you brought this up. And for all you patients, I'm gonna recognize you as DS, and then doctors, dentists. So DS is so important because, you know, we have been brainwashed in the field of dentistry that anytime a patient's asking for pain medication, then they're a drug seeker. And that's unfortunate because a lot of the profession of dentistry, we basically made that issue because we do these procedures and give like Percocet, hydrocodone, which are like drugs that are very addictive and they're easily resold around town. And so typically what happened is you'd have like a regular tooth extraction. The doctor would give you like, I'm saying this because I used to do it many years ago. I'd give like 20 hydrocodone, and they probably only give 20 hydrocodone, and they probably use it for like maybe 8 tabs and then leave the remaining 12. And then, you know, with all these different challenges and different things like that, at one point kids were going to medicine cabinet, take it, pop it, and they'd get addicted, and it just goes downhill. So it's unfortunate. So I'm not making an excuse. I'm just giving you the rationale on how we as doctors were trained so that when patients hear the story, they're like, okay. So one thing that I do, I call it the JW cocktail, pain cocktail. And what I like to do is this: ibuprofen, 600 milligrams, and acetaminophen, 1,000 milligrams, alternate that over 4 hours. That should knock out any pain. If you need anything else, then a Medrol dose pack will definitely help it out. All opioids are going to do is just make you want to go to sleep. That's it. The pain relief is going to be found in the acetaminophen and the ibuprofen, mixing those and just staying at it. And the last thing, least, is like you can't wait till the last minute. You got to make sure you stay ahead of the pain. Don't let it catch you and then start whooping up on your head. So there you have it, guys. I hope that you were able to find good insight on this information. Like I said in my videos, anytime there's a comment, I'm going to address it. I'm not going to just wait, but I'm going to give you content that's going to be beneficial so that you can smile after surgery. So guys, if you're a dentist and you're wanting to go deeper, I have a free ebook down in the descriptions on it's how to get any patient numb. Also, I have my 21-day smile after surgery challenge. It helps doctors like you who are struggling with taking out teeth, or just may not be struggling but don't have a consistent system so that you could smile after surgery. I have that in there as well, and just some other things so that you guys could, you know, grow and get better. As you can see, DS has some very important concerns, and that we as doctors must address them so that the world could smile after surgery. So there you have it, guys. I'm Dr. Jared Williams, and my focus is for you to smile after surgery. Make it a great one. And don't forget to smash the like button, hit subscribe, and share with your friends. I don't want any of you guys out there squeezing. Make it a great one.